Welcome to Med in 5. The goal of our channel is to break down medical concepts and make them easy to grasp. In this quiz-style video, we'll review key points from our second bacterial series, with case questions to test your recall. Let's jump in. A 21-year-old woman comes to urgent care with loose stools and abdominal discomfort. She picked up vegetarian fried rice on her way home yesterday and reheated it for dinner. Her symptoms began the next morning. She has no fever or blood in her stool. Her roommate, who also ate the rice, texted her, saying she developed similar symptoms. The physician on duty recommends fluids and a light diet. What will the physician most likely say about the expected duration of her symptoms? Next, a 3-year-old girl is brought to the ED after developing difficulty swallowing, drooping eyelids, and weak, sluggish movements. Her parents say the symptoms began this morning, about 18 hours after she ate canned green beans at a family picnic. On exam, she's alert but has poor head control and shallow breathing. She's given oxygen, antitoxin, and antibiotics. Which part of the myosite is most affected by this girl's condition? Next, an 8-year-old girl returns from a trip to a rural province in Indonesia. 5 days later, she develops a fever, sore throat, and fatigue. She was brought to the hospital a week after her trip due to swelling of the neck and trouble breathing. Oral cavity examination findings are shown. Her vaccination is incomplete, as her parents declined immunization based on personal beliefs. Which of the following best describes the causative organism? A. Forms spores. B. Possesses poly-D-glutamate capsule. C. Uses flagella for locomotion. D. Produces bubbles in H2O2. Next, a 67-year-old man, recently discharged after a 10-day hospitalization for pneumonia, returns to the ED with 3 days of fever, watery diarrhea, and lower abdominal cramping. Stool studies reveal the organisms in the image. Which of the following is the greatest risk factor for this patient's condition? Next, a 32-year-old man working in a wool processing facility presents with a fever and a skin lesion on his forearm. 4 days ago, he handled raw imported animal hides. 2 days later, he noticed a small forearm bump that rapidly worsened. Skin examination reveals the lesion shown in the image. Which of the following is a distinguishing feature of the causative organism? A. Needs tellurite-containing medium to produce black colonies. B. Needs 6.5% NaCl for growth. C. Needs India ink to exhibit its capsule. D. Needs minimal oxygen to thrive. Next, a 27-year-old woman, an avid cyclist, is brought to the ED 5 days after undergoing an operation for a femoral fracture sustained in a road accident. She now reports worsening pain, swelling, and a foul-smelling discharge from the surgical site. On exam, the leg is tense, discolored, and feels crackly to the touch. Vital signs reveal fever and a blood pressure of 80 over 50 mmHg. X-rays show gas bubbles in the affected soft tissues. Which of the following virulence factors is most closely associated with this condition? Next, a 64-year-old man with diabetes switches to a high-protein, high-fiber diet to better manage his blood sugar levels. After days of eating mostly refrigerated meals and salads, he develops fever, headache, and neck stiffness. On exam, he's disoriented and complains that light hurts his eyes. A lumbar puncture reveals the organisms in the image. Which of the following food choices could have increased his risk for this infection? Next, a 15-year-old boy is brought to the ED 6 days after stepping on a broken bottle while running barefoot. The wound bled briefly and was washed at home, but he received no medical care or antibiotics. He now has difficulty opening his mouth and muscle stiffness in his neck and back. His childhood vaccines were completed at age 5, but he hasn't received any boosters since, which neurotransmitter is involved in the pathophysiology of this condition. And that's our second bacterial infection quiz. Tap the link in the description to review your answers. If you missed a few, you may revisit our video series to brush up. If you found this quiz helpful, hit like, share, and subscribe. Thanks for watching.